Hi, and welcome to another episode of the Arizona Center for Cancer Care's Cancer Now What vodcast. Today's topic will be treating prostate and esophageal cancer, a physician and patient perspective. I'm so excited here today to be joined by medical oncologist Dr. Abhi Ghosh and one of his patients, Tim, who has agreed to talk with us. And I'm really looking forward to the conversation and understanding what Tim's journey was like and what that's like every day in the clinic for Dr. Ghosh when he sees these different types of patients. So, Dr. Ghosh, we'll start with you. Could you introduce yourself and just tell us a little bit about your role in oncology and even in hematology?
Yeah, sure. So I'm Dr. Abhi Ghosh. I'm a hematology oncologist with Arizona Center for Cancer Care, and we are affiliated with Honor Health Cancer Care. It's a large private practice, and it is multidisciplinary. We have radiation oncology, gynecology oncology. We have tie-ups with surgical oncologists. We have genetics. We have everything in-house. My practice consists of treating basically all facets of adult oncology, and I see hematology and oncology both. My special interests are GI, GU, and heme, and coordinate the care for all these patients, taking them through their journey, starting from beginning to the end.
Great. That's a noble thing you're doing. Thank you. It's quite the profession.
I want to be as helpful as I can be.
Oh, that's amazing. And Tim, would you mind introducing yourself?
Yes, my name's Tim. I grew up here in Tempe, Arizona, most of my life, and my background is in architectural design. Spent a lot of years in the design field and saw a lot of great, projects with that. But then this journey came to me.
So share a little bit about this journey with us. How did it start? Where did it start? And how did you eventually get to Dr. Ghosh?
Well, the first hoop that I jumped through was when I was told that, when I was seeing my urologist, that I had a high PSA number. And, they did, the tests on that, and then they did a biopsy on that and determined that, it was definitely prostate cancer. And they recommended, a surgeon. And I went through the whole prostatectomy process. And in addition to that, I was referred to Dr. Chowdhury to do a radiation program. After I had the prostatectomy, I went through the whole radiation process. And that was okay for a while, but then other things came along.
Okay, so you were just having your regular screening with the urologist. Your PSA was high. They checked you, diagnosed you with prostate cancer, removed your prostate.
Yes.
And then Dr. Chowdhury, who does radiation, he then was treating you for the prostate. And then what happened?
Then that was in 2019. And then in 2020, in the summer of 2020, I developed quite a problem swallowing.
Okay.
Swallowing food. And so a couple of times was actually pretty traumatic. I thought I was going to choke to death.
Yeah, that's scary.
And so they did an endoscopy and, determined that I had an esophageal tumor. They took biopsies of that and said, yes, it is cancerous. And so at that point, I was referred to Dr. Ghosh by Dr. Chowdhury. Dr. Chowdhury said, well, we'll do some radiation on your tumor, but you're going to need to go into a chemotherapy infusion program.
So you already knew Dr. Chowdhury, unfortunately, from
Yes,
your experience with prostate cancer.
Yes.
So when you got re-diagnosed, you called Dr. Chowdhury and said, I need help again, please, what should I do? And he said, I will help you, but you also need to see somebody in medical oncology for chemo,
That is
potentially.
correct.
Okay,
That's correct.
Got it. So it sounds to me that that Dr. Chowdhury really had to serve as kind of a quarterback for you with all of getting you to the right people for the right stages of your treatment.
Yes. I mean, it was Dr. Chowdhury that I, told him, I said, I'm having serious problems swallowing food. And he said, well, we need to, figure out what's going on.
Got it. And that's when you got involved, right, Dr. Ghosh? Right. What was the first appointment that you had when you first had Tim in your clinic? What was that like for you the first time you met him?
So I could tell obviously that he was nervous because he had just fought one cancer. He, went through prostate cancer treatments and had surgery, radiation, and all these treatments for it. His prostate cancer was doing great, but now unfortunately he's having to deal with another kind of cancer which is completely different. This is esophageal cancer, completely different area of the body. So first thing we did was we told him that, let's finish our workup, let's complete our staging, and then we will determine the treatment protocol. There is always a solution. So we started by doing a whole body PET scan. Unfortunately, that showed evidence of metastasis in multiple areas, multiple bones of his body, his adrenal gland, and that's when we decided that unfortunately there is no point doing surgery for the esophageal cancer because it has already spread. So now he has stage 4 esophageal cancer. We had to start him on chemotherapy, and he did so well with the chemotherapy protocols. I mean, we started him on the standard chemotherapy protocol and he did really well with it. His cancer shrunk. His esophageal cancer started responding very well. We got great control, but then unfortunately his prostate cancer started resurfacing.
Oh no.
So his PSA started going up and we did biopsies, I believe. Again, there was evidence of spread of cancer in the bones, and we had to do a biopsy, and to our surprise, this time it was stage 4 prostate cancer. So he's fighting 2 stage 4 cancers at the same time. So that was the challenging part.
Wow.
And we had to tailor our treatment to deal with 2 cancers and minimize the side effects, use medications that hits both without causing any overlapping toxicities.
Mm-hmm. And what was that like for you, Tim, when Dr. Ghosh said, we've got this esophageal cancer somewhat under control, but now we also have to fight the prostate cancer again? What was that like?
It was, it was kind of like the first hit of, it really kind of set me back a little bit to think, okay, well, things were going well, maybe things are not going to go so well at this point. But I've always kind of had the attitude that you go with the flow and, just go with what, you're here to be treated with specialists. So, go with the flow.
That is a great attitude to have, because how common is it for somebody to present with 2 stage 4 cancers at the same time?
It's very, very uncommon. I mean, it's hard to deal with one cancer to begin with, and now you're having to deal with 2 cancers, and that too in stage 4. So, and then we are needing to determine which cancer is controlled and reacting and behaving with the chemotherapy versus the other. So it's an extremely rare situation.
So how do you then monitor them both at the same time to see what's responding?
So it's based on his symptoms, our clinical judgment, our clinical skills. We rely on blood numbers, like the PSA is a good predictor for prostate cancer. Then if in certain situations we have to do biopsies to know actually which one's getting worse. So he has had cancer going to weird places, like the left femur bone. He had to have surgery for that. It came to his finger bone, my hand, and he needed radiation for that. So wherever the cancer went, we had to determine where it's coming from and treat it accordingly.
And when was the last treatment?
He is still on treatment.
Still on treatment?
Yeah, he's still getting chemotherapy, and we are having to tailor the treatment somewhat to make it manageable and tolerable for him. He has had breaks, which is very normal. Sometimes he has had side effects to chemo, sometimes he has had infection. For the prostate cancer part, thankfully he's only needing anti-hormonal treatments, which consists of an injection and an oral drug, which is keeping it under control. For the esophageal cancer, he is needing actually IV chemotherapy.
And how often do you get that?
Well, when I'm actually doing it, it's usually every 2 weeks.
Okay. So you have cycles on, cycles off. You take
Right.
breaks. Right. Okay. Good. And how do you feel?
It's up and down. I mean, I would say the most significant side effect that I've experienced is probably fatigue. You know, I didn't really experience a lot of nausea, anything like that. So mainly fatigue.
Okay. Well, and I know, Dr. Ghosh, I've heard other medical oncologists that I've talked to say that part of your job is to manage those side effects and make sure that they don't take over your life and make it unbearable. So how do you manage it when you're dealing with not just one, but 2 cancers and lots of different drugs?
So that's part of the job. I mean, it comes with what we do. I mean, I'm meeting him almost every 2 to 3 weeks and constantly asking him about the side effects. And then I have to analyze that this side effect is coming from which drug, whether it's a prostate cancer drug, whether it's a esophageal cancer drug, and then we have to determine which one we can cut down on doses, which one we can postpone, which one we can give a break on, which cancer is better behaving. So that's the skill of medicine, and that's what we have to do when we meet him every time.
Okay. And how much longer will this have to go on?
Hopefully for the next 50 years, I don't know.
But so it's an ongoing chemo.
Yeah.
It's not like you do 15 rounds and then you're done. It's like this is what we're going to do to keep you healthy.
Correct.
Going forward.
I mean, obviously with having breaks in between.
Yeah.
And we try to use the minimum amount of treatments possible and the maximum amount of breaks that we can get.
Yeah.
Obviously, quality of life is very important.
Sure.
So I always tell him that, you know, if you're going on a vacation, if you're going for something fun, we will work around it. We want you to have fun. We want you to go for trips. We want you to enjoy your life. And we will do what needs to be done to make that happen in terms of making changes to his treatment.
That's amazing that you can just have your life around just coming in and getting this treatment. That's awesome. That must be really satisfying to hear from your doctor.
Well, it is. It's just that in the mix of all that, I've had, they determined that I had a bone lesion on my femur bone on my leg, and that required orthopedic surgery and recovery and physical therapy. And then I got this bone lesion on my hand, and it was very painful. And I was told that it was pretty rare that it would happen to your hand. So I've had things happen, and some of the, you know, the results of the surgery, the prostatectomy, I've had some urology surgeries done to me, so I've had to see other doctors, other surgeons for some things, but it always circles back to right here.
Gotcha. So now Dr. Ghosh is the quarterback.
Right.
At this point. Got
Yes.
it. Got it. Okay. That makes perfect sense. And are you going on vacation? Are you living your life? Are you doing the things when you're not in surgery?
Well, usually I do try to travel. 2025 was last year was not a good year for me. I was in and out of the hospital 3 times for various things, infections and things, and so I didn't do any traveling last year. And because of things that were going on, I went off of infusion and went on to oral medications. But of course that, you know, was not, I guess it was described to me as, you know, my testing has shown that it has not been as effective as treatment that I've had in other treatments I've had in the past. So now we're going back to what has been determined that has worked for me.
So it's a work in progress.
Correct.
It's a
constantly evolving process.
And, you know, I was told numerous times that, you know, this is going to be probably an ongoing maintenance thing.
And how do you feel about that?
Well, when I first heard it, I felt really down about it. and but I got over that.
And it has been 5 years. So since you were first diagnosed with the metastatic,
The esophageal?
The esophageal was, my prostate was diagnosed and treated in 2019, and the esophageal tumor was determined in 2020. So I've been with Dr. Ghosh since 2020.
So 6 years
with
with two metastatic cancers.
Exactly.
Very aggressive cancers.
Yeah, that's why it took a moment for me to realize how long it has been, because more than 5 years.
And at 5 years, that's like the main goal, right? Like that's amazing that you got, and you're just still and you look fantastic, and you're plugging along, and you're living your life.
I mean, what's the alternative?
Exactly. That's a great attitude. That's such a great attitude.
And my mother was a career nurse and a hospital nurse, and she always would say, you go to doctors for a reason, and you do what they tell you, and you behave. And so I've tried to behave.
Has he behaved, Dr.
He has
Ghosh?
been an amazing patient. He has been a champ, and patients are like this, and they're ultimately the results that we get is what drives us in our daily, that's why we are here. I mean, that brings us the most satisfaction from our job.
Makes it all worth it.
Exactly.
That's amazing. Well, I wanted to ask you guys, was there a pivotal moment during treatment that strengthened your partnership or changed the dynamic between the two of you? I imagine it probably was somewhere around, oh, you got another cancer now, or this is a second cancer.
I mean, I would say the best moments that we share together are when we get like excellent results, like when we do a scan and we see like things have almost resolved completely. Things are in complete remission. Like we get a PET scan, nothing's lighting up, PSA looks excellent. Those are the moments that we have cherished together. I think obviously those are moments where, both of us feel so proud of ourselves.
Because it's a team effort.
Exactly.
And what about for you?
Well, at a certain point in time, I think personally for me, it took me a little bit of time to, accept the process and feel comfortable that I was in a good place with, good doctors. I've been very fortunate from the beginning that I've been with Dr. Ghosh and Dr. Chowdhury. I haven't had any change of physicians. And at a certain point, my attitude was, this man became my hero. And, I think those kind of things just kind of hit you, and, you place your faith in another person. I think, your life changes when you have to put your faith in someone else.
And how did you know that he was the guy to do that with?
Well, every time I met with him, it was just, which was frequently, a lot, a couple of times a month, just straightforward conversation, reassuring conversation, and, very good about, alleviating my fears and, giving me the information I needed, and, we'll see you in 2 weeks.
But like I have told you before, that the actual hero is you, because it's your journey and you are going through this, and I'm just there to support it.
Right.
So I've always told him, he tells me I'm his hero, I tell him that you are actually my hero.
I'm going to get you both capes, because you both deserve them, for sure, definitely.
Thank you.
Well, it's just that my attitude is that, you have to put your faith somewhere, and it might as well be with your doctors.
Your care team, absolutely.
One thing that I always maintain with patients is that I am pretty direct with them. Like, I just say what it shows, and then we form a plan to alleviate the emotional and the physical aspects of how to deal with it. So I try not to sugarcoat too much. So I think that's what patients appreciate.
Yeah, definitely. So it's kind of this is what we're dealing with. This is what I think we should do. What do you think? Are you comfortable with this? Yes? Okay, let's get it.
Yep, and obviously we give alternatives and other options, and then we let him decide.
And did you feel you were really in charge of that decision when you were going through this?
And I think the main thing that I came to realize is that, I was concerned about what was going on, but I wasn't necessarily scared. And I think that at least for me, there was a difference. It's like I have to take this seriously. I have to, go with the program. And I mean, I've had some low moments where, you wonder where is all this headed? But at the same time, things have been going, I guess, from a clinical standpoint, everything's gone pretty well.
That's amazing. So when you speak about the low moments, there has to be support, family, something outside of this space to get you through that. How is that manifested for you, and how much of an impact has that support been through your journey?
Well, most of my family is no longer with us, and so I had very little family support, but I'm very fortunate to have a great circle of friends who have been very supportive and help me, when I have procedures, surgical procedures done. But, for the most part, haven't had to rely on anybody. I drive myself to my tests. I drive myself to my treatments. I do what I have to do for myself. And when I need help from somebody, there's good friends that have been there to help me.
That's amazing.
It also shows how motivated he is, that, fighting 2 diseases with all these drugs, he drives himself here, go to tests himself, and takes care of things.
Just take care of business.
Yeah,
that's right.
It's amazing. Good for you. I wanted to ask just another question here about what continues to drive you, Dr. Ghosh, as an oncologist.
Exactly like I mentioned before, it's patients like him and other patients. When we see positive results from what we are doing, I think that's exactly what drives me. And I think my happiness is in the patient's happiness, their sadness is my sadness, and my team's sadness. So it's everything is in sync with each other, like their success is our success.
And it motivates you.
Exactly.
That's amazing. And what would you tell people who are just at the beginning of a journey like yours? What advice would you give if you could go back and give yourself advice at the beginning?
I think the number one thing is that you have to believe that there is a solution out there for you. It may not come to you exactly, in the fashion that you would like, but, and I think some of the best advice that I was given by other patients was, if you have questions, I would type up questions, bring them in, and I would try to be organized about what information that I wanted. When I wanted to have a friend come with me to hear test results, I would bring a friend. And so, it is important to have some key people that are gonna, have your back and participate with you. But, I pretty much have told myself I'm capable of doing most of this myself. And until things change, well, then we'll deal with that later.
Well, and I know so many resources in the community that can become overwhelming. There's so many groups and programs and things. And I know that here at Honor Health Cancer Care, there's navigators and people that can help you find those resources if you need them in the community.
Yes,
social workers,
all of those things. So that's so important that you get that level of support here when you need it, for sure. Well, thank you both so much for sharing your story and your journey together and your clinical expertise with me. I really, really appreciate it. And I wish you so much joy and happiness in your life, Tim. And Dr. Ghosh, I'm going to get you that cape. We're going to get it.
For both of us.
For both of you. Both of you. Yes, we'll get matching capes for the two of you.
Thank you so much.
Thank you.
Thanks, Tim.
And thank you so much for watching this episode of Cancer Now What? I'm so glad that you were able to join us. My name is Jenny, and thank you to Arizona Center for Cancer Care for sponsoring. We'll see you next time.
you.